Everyone, I just wanted to give a brief update of my Lyme symptoms and just kind of what I found out from the test results. So last week I was feeling pretty crappy, just really bad neuropathy, pain in my thoracic spine, in between my shoulder blades, and just really bad headaches. I'm still getting inflammation in my spine, and I'm still getting headaches and a little bit of tingling in my feet, but it's definitely subsided a little bit. I did get the test results back on Friday, and for the ELISA test, I was negative for an acute infection. And originally I was really excited about that, but then, of course, it's a little confusing too because you have symptoms of something, and with a negative test result, it just kind of leaves you hanging. On Sunday, my symptoms started to get a little worse. I woke up several times in the middle of the night with my arms numb, and which is pretty common when you sleep, if you sleep on your arms the wrong way for them to be numb. However, for me, they were just numb for a few minutes, and it was just really scary. Started squeezing them and moving them around, just could not get the circulation going, and just a really bad headache, just very, very tired, and just kind of seemed a little out of it, very emotional. So I called my family doctor, and they thought it would be a good idea for me to go to the ER and get checked out. So I went to the ER, kind of gave them my spiel about everything that's been going on with me with the Lyme, and just how I've been struggling lately with, how I've been feeling and not really knowing how to treat my symptoms, and how I didn't want to just go to the ER and then just be discharged with no clear answers. So they agreed to do an MRI of my brain, and I did get the results back that day. They said that it was clear and that there's no lesions, nothing that they can see that's significant, that shows any kind of significant damage from either MS or from Lyme's, which is really good news. So I was very happy to hear that. However, I still had the symptoms, so it was a little discouraging not to know what was causing it or what I can do about the pain. So that evening and throughout the day, I just tried to get plenty of rest, and on Monday, just had a surge of energy, felt so much better, a little bit of inflammation in the morning of my spine, and a little bit of tingling in my hands and feet, but I just wasn't going to let me get it, I just wasn't going to let it get me down. So, I just did everything I could, around the house since I had that energy, cleaned out the fridge, did the dishes, started up laundry, just all my household duties that I feel like I haven't been able to do lately. And I did call my doctor to find out if they got the results back from my Western blot, which is not the acute infection, but just kind of shows if you have any of the strands of the disease in your body. And I got a call back about an hour later, and she did tell me that I tested positive for one strand of the bacteria. So now I'm kind of confused. She told me that she does not want to treat me for it. She does not want to give me antibiotics. She thinks that it'll just dissipate on its own. However, since I'm symptomatic, I'm a little confused about why she is wanting me to not do antibiotics. And I'm a little torn about the antibiotics myself, because some things I read says that, if you continue on antibiotics, then it can make your issue worse. That the bacteria becomes more and more resistant to it and finds other tissues to hide in, and replicates itself and mutates, and it's just harder to treat later on down the line. So that's one side of it. And then there's the other side of it where people say, well, you were just diagnosed with Lyme's, or you found the tick on you in February, you're still within a year, let's hit it hard with antibiotics, go ahead and get it cleaned out. And then, that way you won't have any long-term chronic Lyme later in life. Like, this is the quote-unquote perfect window for antibiotic treatment. So, I've heard both sides of it, and I really don't know what to do. My instincts say to kind of go the natural route, which is kind of, what I've always wanted to do, but just this bacteria is very tricky, and, you definitely don't want to let it go because you don't want it to cause permanent brain damage, especially since the kind that I have does not affect my joints at all, never has. It's only affected my central nervous system. Occasionally, I get some muscle fatigue that goes along with it in my legs, or, just some nerve pains, but it's this particular strand that I have, and I don't know the actual number. But the particular strand that I have does cause quite a bit of central nervous system issues. So it's just a little scary, and I don't really know how to go about treating it. I do have an appointment with Longevity Health Center, Dr. Anderson, and I really feel like God is pointing me to go the homeopathic route, to go see a naturopath, I should say. He specializes in Chinese medicine and acupuncture, and he's a devout Christian. And I've heard just so many success stories from the patients that have gone to see him. Unfortunately, he's very expensive, and he's got a 4-week lead time before I can see him. But I am confident that I can get some answers from him. So, in the meantime, I did schedule an appointment with another infectious disease doctor. He is the one that I got a second opinion from when I was getting the Lyme's treatment in the beginning. So he was very nice and very knowledgeable. Unfortunately, he's just a little bit further away from where I live, so that's why I didn't continue with him. But I'm going to go see him on Thursday, and just kind of run by, him, my symptoms, and also the fact that I did test positive for one strand on the Western blot, and see if he has anything to say about it and what his recommendations are, since I do trust him as a great physician and infectious disease doctor. So I do want to get his perspective on it. So that's kind of where I'm at. I am feeling a little bit better. I'm hoping that it was just a cold that triggered some symptoms and that it'll just continue to subside. But I'll have another update next week. Thank you.